my name is Crystal, and today we're going to be doing a recovery sequence for your hips and your lower back. The equipment that you will need is a block and something comfortable that you can kneel or lie on. Especially if you have tender knees, we're going to be going into a little bit deeper of a quad stretch today. So if you need an extra pillow to put underneath your knee, grab it, and then let's start together. We're going to be starting in a kneeling position. So if you want, you can just transition with me now. And I'll just have my right leg forward and my left leg back. And from here, we're going to just make sure that our knee, hip, and shoulder are stacked on top of each other. We don't want to be in a long extended lunge, just for this stretch. From here, we're going to make sure that we bring our pelvis forward. Okay, so into a neutral position. A lot of us kind of hang out in this anterior pelvic tilt, which puts a lot of stress on the lower back, and it keeps our hip flexors tight all day long. So we're going to open that up by squeezing our bum cheek, engaging our lower belly, and bringing that pelvis into a neutral position. Okay, we're going to hang out here for a couple breaths. So nice big inhale, full expansion of the lower belly. And as we exhale, I want you to focus on relaxing the shoulders. Our breath is really connected to lower back pain. So it's really important as we're mobilizing that we just stay in touch with our breath. Okay, from here I'm going to get you to stay here, but all you're going to do is your lower limb, so that lower part of your leg, it's pointing straight back right now. We're just going to turn it so that the toe is turned in. So you're just going to pull that leg in a little bit. It's going to rotate things, and again, keep that pelvis into a neutral position. And when we rotate it, we kind of change where we start to experience that lengthening. Okay, so again, nice big inhales, exhales. We inhale through the nose, expanding the belly. And as we exhale, our shoulders soften. Just making sure that you're staying tall and long through the spine and that you're not slouching back, trying to get that hip to jut forward. We just want to create extension through here. We're not trying to create any extension through our lower back. Good. So we're going to stay here again. We're just going to bring that knee back to pointing straight back, and then we're going to bring it out a little bit. So you're just going to twist it out. Okay, and same thing, bringing that pelvis into a neutral position. And again, just notice how that slight rotation just changes things ever so slightly. Okay, and again, we think nice big inhales, that full expansion. Exhale, soften through the shoulders. Keep that tension to the bum cheek, that little glute. Stay tall through our torso. Good. Bring that knee back, and we're just going to switch legs. Okay, so we start here. Just check to make sure that the knee, hip, and shoulder are all stacked on top of each other. From there, we tilt that pelvis into a neutral position, because again, often I see people here in this anterior pelvic tilt, and so what we need to do to start to lengthen those hip flexors is make sure that we're not in that position. So we squeeze our bum cheek, engage those lower belly abs, make sure that we're tall and that we're not slouched back. Okay, and then we just spend a little bit of time here. So again, we just settle in using our breath. Inhaling through the nose, exhaling through the mouth and softening the shoulders. Okay, then we're going to stay here, but we're going to create a little bit of rotation. So we're going to pull that foot in towards the body first. Okay, and again, just check that pelvis. Think about squeezing the bum cheek, staying tall through your torso, and just notice where you feel that in your body, if it changes at all. And we're just bringing awareness to the hip as we kind of work with those different muscle striations and the way that the tissue and the fascia kind of integrate through the whole system. So when we only stretch one direction all the time, we miss all these other fibers that kind of weave in through the system. So it's good to kind of, like let our body flow and feel those different ranges out. Okay, moving inward, attention on the breath, tension in that bum cheek, and we're tall with our shoulders relaxed. Good, bringing that knee back so that it's pointing straight back from the knee, and then we're going to move the foot out away from the body. So just a slight rotation. Okay, we don't want to move into pain, so just move with the range that you do have. Then check and squeeze that bum cheek. And again, it's just a noticing. We're not looking for any super deep, crazy stretch here. We're just noticing, what do I feel inside of my body? What's going on for me? Can I breathe and soften into the tension that I'm experiencing? Okay, we're going to move that leg back, coming to a tabletop position. Bringing the toes together and the knees out, just wide enough so they're just outside of the rib cages. We're going to take a nice big inhale. We're going to round our upper back. And as we exhale, just let our hips sink towards our heels, bringing our forehead to touch and letting our hips sink and lengthen through the lower back. Taking a nice big inhale, expand the belly, press it into the thighs. And again, as you exhale, those hips sink towards the heels, lengthening out the lower back. We're going to come up. So we inhale. I want you to round your upper back. You're going to walk forward. Let those hips sink. And you're going to slowly let your body come down to your chest. Let your forehead touch. And then we're going to reverse up. So we lift the chest, extend, press those hips back, round through the upper back, and forehead to touch. Let the lower back and hips sink towards the heels. Taking a couple deep breaths, nice big inhale, exhale. And again, inhaling through the nose, exhaling through the mouth. And we're going to come up. So we inhale, coming up. Just extending the legs, bringing the hips towards the floor. We're moving nice and slow. And then we slowly lower our body down to the floor. Forehead to touch. Good. Then we inhale, lift the chest, extend the arms. Exhale, press the hips back, round the upper back, and drop down. Again, keep your attention on the breath. We're going to go through that 2 more times. So inhale, coming up, extending the legs, letting the hips fall towards the floor. Slowly lowering our body down. Forehead touches. And just pause here. Inhale, lifting the chest, extending the arms. Press the hips back. On the next inhale, just coming back to your tabletop position. And let's just transition over onto our backs. So both legs can be extended. We'll start by bringing the right leg in towards the chest and just wrapping our hands around the shin, letting the left leg be extended and heavy. taking a couple deep breaths as we settle in. So we inhale through the nose, expanding the belly, pushing it into this thigh. And maybe it actually pushes this thigh away a little bit. And on the exhale, when the belly collapses, makes room. And maybe you can pull it in a little bit more. As you inhale, we're going to release that leg. Just give it a little shake. We're going to switch over to the other side. As we inhale, pulling the knee in. Exhale. Okay, this leg is extended and heavy into the floor. Inhale through the nose, expanding the belly, pushing the left thigh away. Exhaling through the mouth, belly collapses, and gently pull the knee in towards the chest. On the next inhale, we're going to extend the leg, give it a little shake. I'm going to get you to pull both knees up. We're going to cross the right over the left and kind of let the feet come out to the sides. Then we're going to reach with our arms and grab the ankles and gently sink back down. Okay, now if you can't reach your ankles comfortably, like maybe you're still kind of in this position, you're like, I don't know how I could ever lay back, just grab some straps so that you can be in this position in a relaxed place, so that you can let your upper back relax, that your whole back is on the ground. Okay, you might feel this through the outside of the glute. This is also a really great piriformis stretch. But be gentle with these guys, okay? We're not trying to think the deeper the better. We just want a little bit of stretching awareness. And we use our breath to sink deeper into it by softening the tissue, not by tearing the tissue. Don't do that. next inhale, really gentle, you're going to start by releasing the legs, then slowly unwind those hips. We're going to go over to the other side. So now the left leg is going to cross over the right. You're going to kind of let the feet come out to the sides. You're going to sit up a little bit, grabbing for the ankles, and then you're just going to sit back. This side is tighter. So nice big inhale, exhale to begin. And remember, if you can't comfortably sit here and grab the ankles, grab a towel or a strap so that you can kind of extend your reach. You want to make sure that your neck and your shoulders are relaxed and that this is more of a passive position than you actively hanging out here, gripping as hard as you can. On the next inhale, just releasing the hands, letting the legs come to feet to the floor. And I always like to kind of just windshield wiper my hips from side to side. Just kind of letting the lower back and the hips just release. And whenever you feel ready, we'll come up to a seated position. And that is our recovery sequence today. Thanks so much for joining the movement.